Good evening, and I want to welcome each and every one of you to this last session of Share Your Story with cancer patients who have walked the journey and some of them who still involved in the journey. And this evening, we will be bringing on two very interesting guests. One who will tell a story, and we have a very special guest in house this evening. I'm so glad that he was able to make it. I wasn't sure, but he made it. And so I'm grateful and thankful for that. But I want to welcome you all this evening to this last session of Share Your Story. It's been a good event for 6 weeks. We started in October to highlight Breast Cancer Month. And then we had to continue into November because so many persons wanted to hear different aspects of cancer. And that's how come the show was extended. So this evening is going to be a very special evening. Before I bring the guest on, I want to say thank you to all who have supported the event for the past 6 weeks, and also to Palmdale Vision Center and to my husband who did all of the work for me and provided the information. And so thank you to him, Theodore Jackson. To my son also, he was my tech person. And so I want to say a big shout out to both of them. And to our very special audience. And for those ladies who participated on the show over the past few weeks, I want to say thank you. Continue to stay in your lane and continue to do well as you journey through your cancer experience. Now this evening, I have a special guest, one who is going to share her story with us. I met her on a show, and when I heard her tell her story, I said, we must have this lady come on and share her story to the Bahamas and to the world concerning what's happening in her life with cancer. And we will also be bringing in her special doctor who's been working with her. And he is one of the gems we have in our country because he is one of our medical oncologists. And I'm going to welcome both of them into the show, and I will let them introduce themselves. So right now, let me bring them in. And I want to say welcome to Dulcie Darling and to Dr. Davad Curling, who is the medical oncologist here in the Bahamas. He has studied in the United States. He is certified. He's been working with so many women and patients here in the Bahamas, in particular with breast cancer. And so we are so privileged to have him on with us this evening. And so I want to welcome both of you, Dulcie and Dr. Curling. How are you both doing?
Great, Dr. Jackson. Glad to be here.
Curling, how are you?
I'm doing fine.
He's such a busy man. And I didn't know if he was going to show up, so I didn't even put him on the fly. But when we spoke this afternoon, I said, thank you, Lord. He will be here because
I gave you my word 6 weeks ago. I don't break
yes,
it. So.
because we didn't communicate it, I wasn't sure what was going to happen. But I'm so happy that you've chosen to come on, Dr. Curlin, this evening. And we will start the show, though, with Dulcie. We want Dulcie to give her time to share her story. And we will ask her questions in between. And if persons have questions they want to ask, and then we will have you come on, Dr. Curlin, and basically talk about what you're saying with breast cancer here in the Bahamas with our women and even with men, if you're seeing any of them, and just give some information. And if any of the guests have questions, we will ask you that also. So Dulcie, first of all, I want you to let the audience know who is Dulcie Darling and where's Dulcie Darling from?
I'm a Bahamian. I've been working with the Office of the Judiciary as a stenographer for the past, 18 years, 19 years. I'm a single mother. I have a 24-year-old who I'm very proud of. I've been battling with cancer from 2014. And as you said already, my team, Dr. Devon Curling is my oncologist. And of course, oncology consultants, they're the team that I work with that have me still living all this time. And they said I wasn't going to make it through. I think they gave me 6 months or less than 6 months. But I'm still here 6, 7 years later, thanks to them.
Which island are you from, Dulcie?
I am from Nassau. I've been in Grand Bahama from 1987, but grew up in Nassau, went to school in Nassau. I went to St. John's College, graduated from St. John's, moved to Grand Bahama in 1987. Been here ever since.
Okay, so you're not originally from Freeport, but I don't think nobody's originally from Freeport. And most persons have either migrated to Freeport for some reason or the other.
Yeah.
So when were you diagnosed with breast cancer? Tell us your journey.
I was officially diagnosed in January of 2014. I started feeling what I consider feeling symptoms from August of 2013. It started with what I thought was a mere air infection because I didn't consider anything else. I didn't consider cancer. I was a vegan at the time. I worked out. I was relatively healthy. I always maintained my weight at 135, 140. 140,
now,
I would consider. Go ahead.
Why you thought it was an air infection?
The glands at the back of my ear, both of them were bothering me. It seemed as if I was getting pains in my ear. Both glands were swollen. And at one point, it seemed as if I had a slight discharge out of the ear. And so I figured, well, it has to be an air infection. I went to the ear, nose, and I went to my general practitioner first. And then he referred me to the ear, nose, and throat specialist. I saw ear, nose, and throat specialists who said they didn't see anything wrong. They saw something coming out of the ear, but they said it's usually you only get an ear infection in one ear. It's not typically both ears. So I went back to the general practitioner and I told him, I said, well, they said it can't be the ear, but they gave me some antibiotics. And I said to him, I said, I'm a vegan. I don't use antibiotics. I will take the natural route. That's what I said to them. Came home, took the natural route for about 2 weeks and it wasn't getting any better. So I went back and I got the antibiotics. And it seemed like I took the I did the cycle of antibiotics and my stomach felt upset. I started throwing up, went back to the general practitioner. I said, look here, these antibiotics didn't work. I'm throwing up. And it progressed. That was in August of 2013. By October of 2013, I could not eat anything. Everything was coming up, even water. Broth was the only thing and coconut water that I could take in. It went from them examining me to, he said, he looked at the symptoms. And at one point he said, yes, your symptoms and this vomiting, it sounds as if something's going on in the stomach. So we're going to do an endoscopy of the stomach area and see what's going on. Did the endoscopy of the stomach, didn't see anything. We went through a battery of tests, Crohn's, colitis. They basically test for everything that they could think of.
What was the time frame for all of this testing during this time now?
October to December. Okay. October to December, they did a number of tests. By December, my weight was 100 pounds or a little under 100. And at that point, it felt as if I put my feet on the ground, it felt like I had spasms just running up my body. And I kept on saying to them, at one point he dismissed me because he said, well, we've done every test that there is. I don't see anything wrong with you and you're healthy. And I kept on complaining. I was like, well, it feels like I'm having a heart attack now because my heart is beating really fast and I have this pain in my back. And he ignored me until I said, you know what, just give me a referral. I will go someplace else, because at that point my family said, no, you look like death. Something's wrong. I don't care what they're saying. There is something wrong with you. And in fact, when he gave me the referral, he didn't even sign off on it. I think I signed that form. He gave me the form and he was a little bit pissed off with me. And I said, well, you can't figure out what's wrong with me. I am presumably healthy. So let me go where I have to go and let them figure it out. And I went to a clinic in Fort Lauderdale.
That he was not me, by the way, Dulce.
I know. We must get that straight.
That was not Dr. Curlin. That was the doctor in Freeport. I should call his name, but I won't. I'll leave that right there.
We're grateful for Dr. Carlin, so we won't call his name.
Yeah. So I got in Fort Lauderdale, and I figured, okay, well, they sent me to we figured gastroenterologist because of the vomiting and because I had not eaten. I literally had not eaten from October.
Hit me.
And so I had lost so much weight. And we went to the gastroenterologist, and he said, well, I don't know what you came to me for, because they did everything that they basically could have in the Bahamas. He said, there's only one thing that I would do differently. I would do a more inclusive blood test. And we did that. And he determined from the blood test that my liver was about to fail. He said, that's why you're throwing up. He said, you're about to go into liver failure. And he said, that's an indication to us that something is happening in your body that we can't see. And so he sent me to do an MRI. He sent me to do, I don't remember whether it was the MRI or the CAT scan that I did first. But whatever he sent me to do, when he sent me to do it, they said to me that you have a number of tumors that are in your body. And at the time, I didn't understand what tumors. I heard him saying tumors, but you know, in the Bahamas, when we talk about breast cancer, we talk about lumps. You don't say tumors. The language that he was using was unfamiliar to me. So I said to him, I said, what do you mean I have a number of tumors? He said, you have tumors all up your spine, all on your pelvic bone. He said, throughout your body. He said, but what do we have to do? We have to do some more tests to determine what it is. After that, he sent me to do a mammogram. And then I started putting two and two together, but I still insisted. I said, I do mammograms every year. So I don't know why you're sending me to do a mammogram. And then when I went to do the mammogram, the technician kept on going back to the same area. And at the time, my sister-in-law was with me. And I said, there's something in that left breast. I don't know what it is. I don't know what it could be, because I did a mammogram last year and there was nothing there, and I don't feel anything there. Fast forward 2 weeks later, they said to me, the gastroenterologist called me in and he said, we're going to refer you to the hematology department. We're going to refer you to see an oncologist. I was unfamiliar with the term, didn't know who an oncologist was. And my daughter was with me. And of course, you know, children Google everything. And they said to me, they brought in there were three of them that came in. And I was looking at them and saying, well, why all three of you have to come in? And I think it was a social worker from the hospital. And she's giving me her card before they even say anything. And they were like, well, we're going to have to refer you to the oncologist, and the oncologist will let you know what's going on. But if you need somebody to talk to after that, we're here for you.
Sick.
I went to see the oncologist.
Sick.
She had to also do a number of examinations to figure out what was going on. They never used the word cancer. I don't think they used the word cancer until a month later. When she finally said to me, she said, you have stage 4 breast cancer. And I was baffled at that because as far as I was concerned, there was no lump anywhere. I didn't understand what was going on. She said to me that unless she had seen the CAT scan, she would not have been able to determine that it was breast cancer. She could not have seen, she didn't know where the lump was until she saw those examinations. And then she said, that's how I was able to feel it. But she said, ordinarily, nobody else would have found it. You probably would have died from liver failure and they would not have determined that it was breast cancer. But at the time that they gave me my diagnosis, that was in February by this time of 2014, I said to them, what stage was it? And is there anything that we could do? I said to her, well, all I know about breast cancer is women usually get them cut off and they're usually okay or they usually die. And she said to me, you're stage 4. We cannot cut you. She said, this cancer is basically throughout your body. If we cut you, you probably aren't going to live. The best that we can do for you is to make you comfortable. And at that point, I was in a lot of pain. She said, all we want to do is ease the pain and make you comfortable. So I said to her, in short, I said, how long do I have to live? Because that it sounds to me like you're trying to tell me something. I said, my daughter's graduating in June. What are you trying to say to me? She said, you're probably not going to make it to June of 2014. And so when I came back home, I wanted to start. I said, well, whatever you're going to do, why can't you start it here? She says, no, you don't understand. I need you to go home so that you could be comfortable, so that you can be with your family and your friends. And so when I came back, I determined that was it until somebody, one of my girlfriends in Freeport, started making some phone calls. And she said, look here, I made some phone calls. There's an oncologist in Nassau. He is off, but if you get here by Saturday, he will see you on his day off. You could fly into Nassau. That was Dr. Turnquest. I saw Dr. Turnquest, and he said, he listened to the story that they said to me, and he said, you know, you're too young to die. He said, if you allow me to treat you aggressively, I can perhaps give you 2 more years. And I bowed with him because I said to him, no, the hospital in the States said this is what the treatment is, and this is what I need to make me comfortable, and that's all I need. And he said, let me do what I need to do. In fact, he said to me, he said, my colleague, Dr. Curlin, is the one who comes to Freeport. You can see him, and he will be able to tell you where to go from here. And I met Dr. Curling. I looked at Dr. Curling, and at the time I saw Dr. Curling, he didn't have any gray hairs. And I was looking at him, and I said, send this little boy to look after me.
I hope you didn't contribute to any of his gray hair then, Dulcie.
I think I did. I went through my head, they send this little boy to look after me, and I'm about to die. And immediately I felt comfortable with Dr. Curling. And from day one, Dr. Curling looked at me, and all I said to him is, I wanted to make it to my daughter's graduation in June. This was February or March. And he said, look here, we ain't going to high school graduation. We're going to college graduation, okay? Just get past this high school graduation thing. I started my treatments in March. Like I said, that was 2014. This is 2020. I've been through about 23 different medications. What happens is that I would start one, it would stop working. I would start another. Each medication comes with different side effects. Some of them have been very good. Some of them have just been dreadful. But through it all, I am still here. And with Dr. Curling's help, I have my good days and I have my bad days. I work just like everybody else. I have a full life. I work every day. I am on vacation now, but I work every day. There's some days that my bones don't allow me to walk up the staircase because they hurt too much. There's some days that I'm on painkillers. There's some days that I am dragging slippers. And when I feel hyper, I put my heels back on because I love high heels. But all the treatment that I have received, you know, I am grateful to oncology consultants. It's not an easy road. It's a very difficult road, but life is worth living. I don't know how much longer I'm going to be able to take chemo. I don't look to that. I know for now my body is still taking the chemo. I know that I have suffered. There are so many different side effects that I have suffered. I went in a building the other day and I only had on one pair of shoes. That's because of the nerve damage that I have in my feet now. I politely just turned back around and followed my trail right back to my car and was right by my car. There are so many different side effects that I have because of the chemo, but I am still alive. And I am going to continue to take chemo until the body says that it can't take anymore. I try very hard to listen to the doctors, listen to what they have to say. Like I said, when I started this journey, I was vegan. I have a lot of vegan friends that tell me, don't put that stuff in your body. That's not, I don't care. I was vegan and it didn't stop me from getting cancer. I take chemo, and the chemo has been able to help me to enjoy. I have a life. My daughter has already graduated from university. You know, she's 24 now. Like I said, when I started this journey, she was still in high school. There are times that, the cancer has metastasized, but it has progressed, thankfully for me, not very slowly. You know, it is when I left Cleveland Clinic, according to them, I had nodules in the lungs. I had nodules in the liver. Like I said, the liver was in bad shape. They said my pelvic bone and my spine was the worst with the tumors. There were tumors in both breasts, but they weren't in the actual breast. They were on the bone of the breast, and that's why it wasn't detected. It has since then progressed into the breast. It is now metastasized to the skin. So I have breakouts on my skin, you know, um, awful breakouts on my skin. When my medication is working very good, um, the breakouts that I have dry up. When the medication has stopped working or isn't working the way I want it to work, it looks like blisters. It starts off looking like mosquito bites, and then it progresses to looking like keloids, and then it oozes. And through it all, you know, I'm at the point now, the medication that I'm on now has dried them up. But there are times when, as a woman, you look at your image and your self-image, and I'm a girly girl. I like dressing up. I like makeup. I like feeling good. I like smelling good. And so all of that kind of plays around with your psyche. But you have to have people around you that uplift you. And it involves more than just Dr. Curling is my doctor. But I have to tell you that it is a team, because Dr. Curling has more than me to, I like to think that I'm the only patient, but he has a million and one patients that he has to look after. Like the expression says, out of all my mother's children, I like me the best. And so I like to think I'm the most important one, but sometimes I can't contact him because he's working with other people. I try, but I am able to call the office. I am able to call somebody on his team and say, look, this is happening with me today. Could you get that message to Dr. Curling, or could you help me? And because he has good people also working behind him, sometimes they don't even have to call him. They could say, Dulcie, this is what's going on with you. This is what you need to do. And the problem is solved. And I think that is one of the things that helps me with my battle and helps me to be so confident with my diagnosis. I know that I am unlike other people who they're in remission. I will never go into remission. I have stage 4 cancer. It is going to progress. I have to live with it. I have to deal with it. Like I said, I'm on medication number 23, I think. And I'm at the point where I've finished with the breast cancer medications. And I am one of those people that watch the TV screen to see if they have a new drug on the market. Because the new drugs are the only ones that I can take now, because I've done everything else. Or I like to call Dr. Curlin the mad scientist too. And even after, when you think your options are gone, he mixes drugs and he comes up with something. He says, okay, I'll try this and I'll try that. Let's just try this combination and see how it's gonna work. And that's what we do. And that's how I survive. And that is how I am living. But I it's not easy. Like I said, it is difficult. Cancer is a hard battle. It is expensive, you know. My cancer bills a month is more than my paycheck, but it is what it is. I want to live. as long as I can. I know that there is an end date. Everybody has an end date. I know there's an end date, but I don't worry about it. I don't hurt my head about it. As long as I'm living and as long as that medication is working, I say to them, you know what? I will probably be on my deathbed and asking them to give me the chemo to see how it's going to work. And I said to them originally, I said I wanted to be cremated. I said, no, don't cremate me. Not yet. No, don't cremate me too quickly. Let's make sure that I'm dead before y'all cremate me. Because I'm going to take that chemo until the last straw. And that's the way I look at it. And I am thankful. There's so many things that I am thankful for. There are people that had stage 2 cancer that were my friends, and they're dead. There are people that started at stage 1 and they're dead. And there were a lot of people pitying me. It's like, oh, you don't have much longer to live. I am still here. And for whatever reason I'm here for, I am grateful that I am here. I am thankful for each day that I am given to live. I don't care how difficult it is. Last week, I did a bone treatment and I had to call oncology consultants because I was in pain. Thursday, I did the bone treatment. I came out of bed on Tuesday, but I'm here tonight and I was able to put on my makeup and look pretty. So I'm good with that. That works for me. Everybody's battle is different. How everybody deals with cancer is different. But the most important thing is you need to have people that are positive around you. And even if you don't have people that are positive around you, it all begins with you. You have to be positive. You have to set up your mind that this is cancer. I am going to fight. You have no other choice but to fight. And then you have to find a team, a medical team that is going to work with you. There's not everything that Dr. Curlin says that I agree with. Sometimes I say, no, I'm not doing it. That's it. But I try my best to, because they have kept me this far, I try my best to do what they say to do. And like I said, you have to make it personal because doctors have 1,000,001 patients. And you have to make sure you can't say, well, the doctor didn't call me back or this or that. That is up to you. That's on you. You are fighting the cancer. You have to learn to fight your disease. You
I
have to
want
take it
to
in hand.
I want to break right here. And your story is just so overwhelming that it's when I listen to you, I'm just like, Lord, I give you thanks. But I have to bring in Dr. Curlin at this point because, Dr. Curlin, is this the norm with patients here in the Bahamas?
It depends on what you're trying to define as the norm. So first of all, Dulcie is not the norm in anywhere in the world. Dulcie is unique. Dulcie is special, and
Yes.
she has a certain vibrance about her. She fills up a room wherever she goes, and this is a familiar story here. And I think the important thing is we don't have enough people like Dulcie who are not afraid to come out and tell their story. And the more people hear stories of overcoming and stories of triumph, the more comfortable they can become with actually accepting that they have a diagnosis. So, unlike Dulcie, for instance, whose cancer came out of nowhere and was a surprise to everybody, we were working it up, nobody could find anything. Too often in the Bahamas, the story is I felt a lump in my breast, but I was scared and I didn't want to go. And then they sit there and they watch these things grow for 3, 4 years. So by the time that you see them, their breast cancer is far advanced. So us seeing people with stage 4 disease is very common. It's a lot more common than it should be. But we also have cases like Dulcie, who people who do their mammogram every year, and they're, I mean, if you listen to Dulcie's story, she's a vegan, she's healthy.
Yeah, that's
Um,
that's what's interesting. Highlighted she's
right,
a vegan, healthy, probably exercising, not overweight, all of these different things.
yeah,
But she presents with stage 4 cancer.
yeah. And unfortunately, that also happens here. And the reason for that is the breast cancer that we have here tends to be an aggressive form of breast cancer. So the amount of times that I've had patients come into me and say, but doc, I just had my mammogram 4 months ago. What do you mean I have cancer? My mammogram was clean. It does happen. Okay. But I think the take home message is the instant that you feel anything wrong with your body, the instant that you think that there's something wrong, you should go in and see your primary care doc. We here, we just don't like to do it, and it's for many reasons. We try our alternative medicines, we pray about things, and then there's just the simple fact of people have in their head, chemo. If I have cancer, let the cancer kill me because I ain't putting that poison in my body. Lots of things like that, and that's one of the attitudes that have to change, and that's also the reason why people need to hear more stories and talk to people and realize that we have many women in this country that were diagnosed with breast cancer 20 years ago, 30 years ago, 40 years ago, who are now sitting down playing with their grandchildren and running around and having a good time. The earlier that we catch it, the better the chance is that we cure it.
Now, let's talk a little bit about holistic medicine as opposed to medical oncology, because that is an issue that many cancer patients have to deal with. Okay. Um, as far as we know, is there any research out there that's available that says holistic or foods cure cancer? It may slow it down, but let's talk a little bit about that, because
Okay,
that is an
so
issue that exists in our country, and it needs to be discussed.
right. So one of the things that I think the longer that you're in the field of medicine, and this is anywhere, the more you realize that the fuels that you put into your body are very important. And um, the longer that I do this, the more I find myself spending a lot more time talking to patients about what you should eat, what you should not eat, exercise, moving. Do we have any foods specifically that cure cancers? No, but do I think personally that living a healthy lifestyle contributes to your overall health? And therefore, if you are someone who is cutting out your red meat, if you can live that vegan lifestyle, if you can focus on trying to do a plant-based diet along with exercise and so on, do I think that you're going to be a healthier person? Do I think that your body's going to have less inflammation all over the place? Yes, we know that these foods can fuel bad things in your body. Now, as for eating foods to cure you, I don't to the best of my knowledge, once you have a cancer, you cannot just treat it with eating the right foods. But I do believe that changing your diet and changing your lifestyle will contribute to how you do after and to your risk of recurrence, and your risk of other diseases. So I think diet and lifestyle is very important. And I mean, the bottom line is we're here talking about breast cancer, but the biggest epidemic in this country right now is obesity.
Yeah.
Okay. And so, do I believe that what you eat fuels your cancer? Yes. Um, do I believe that eating better can help you survive and live longer? Yes. I'll give you, there was a study where we looked at Bahamian women with breast cancer. So we looked at more than 800 women. And more than 80% of the women with breast cancer were overweight or obese. Okay, 80%. So we have to look into that further and see what the connection is. Even more so, of the overweight and obese, the majority were obese. So we have a huge problem. And does obesity contribute to breast cancer? Yes. So um, I don't know about eating food to cure your cancer, but I certainly think that living a healthy lifestyle can decrease your risk of developing a cancer.
That's some good information there. The fact that you talk about obesity, a lot of our women just think, oh, it's fashionable, it's sexy, it's whatever
Yeah,
you call it. However, realistically, we know as a group of Bahamian women, our weight and what we eat can contribute to cancer long term. And so we have to become more conscious, ladies, of our diet. Exercise must become important. Find something to do for at least half an hour a day on a consistent basis. It will go a long way toward a healthy lifestyle. And listening to Dulcie, Dulcie was vegan. Dulcie was never overweight, I don't think.
Never.
Doing all that she thought was right, and still she ended up with stage 4 cancer. Now, Dr. Curlin, let's talk a bit about chemotherapy. I did 6 months of it, and believe me, when I hear Dulcie, I don't even know if I have that kind of stamina. Because when I finished the 6 months, one of my things was, Lord, help me not to have to take that drug again, if at all possible. Talk about the chemicals involved in these drugs, some of the side effects, and what it does to the body. Because I say to patients, do not listen to people who've not walked the journey. Do not let someone tell you who've never experienced chemotherapy
correct.
tell you, don't take it. They cannot add value to your life at all. But let's talk a bit about the medicines that are used to treat cancers.
So I think this is one of our crucibles, right? This is the thing that causes us the most problems. And I tend to be very honest and very direct with people to let them know what they're going to experience. But I think one of the most important things when it comes to learning about chemotherapy is I'll tell you for a fact that the majority of the time, I will tell a patient, you know what? Yes, there are going to be side effects. Yes, there are going to be some issues, but I'll bet you that it's not as bad as all of the stories that you've heard. And generally, people come back to me and say, "Do you know, Dr. Curling, thank you for being honest about that. Yes, I felt a little queasy. I was in bed for a day or so, but you're right. It wasn't as bad as people said it was, and I can live with this." Now, the other thing that I also want to point out now is that things have changed so much. In the last 10 years, the amount of new drugs that have come out for breast cancer that are not necessarily chemotherapy. We've got immunotherapy, we've got hormone therapy, we've got
Mm-hmm.
targeted therapies that target specific genes and specific mutations. So Dulcie can tell you that she's had some chemo drugs. Some beat her up and some didn't. But she can also tell you that she's had some non-chemotherapy, some targeted drugs, where she's like, "Ooh, that's good. It's like a vitamin. I'm feeling good. I don't have any side effects, right?" So, in this day and age, when it comes to the therapy that we use, it's going to depend on very specific different mutations that you have. So, for instance, with Dulcie, we've rebiopsied you now about 2 or 3 times.
Yep.
Yeah. And that's because as more and more new information comes out, we learn that there's a new mutation with a new target. So we say, okay, Dulcie, there's a new mutation out now. We want to check your tumor to see if this new mutation is there and we can treat it with that. Um, and there's been a few instances with Dulcie where we're like, geez, I don't have anything else. And then we biopsy and it's like, oh, okay, there's a new target for us. So things are changing very, very rapidly. And the traditional chemotherapy route is getting less and less toxic as we get better with the drug. So, does chemotherapy have side effects? Yes. But the way we manage those side effects has changed drastically. And so, the days, my famous quote that I tell people is that the days of people grabbing buckets, puking, throwing up all over the place, those days are really gone, right? Usually, in this day and age, when someone gets their chemotherapy, they feel a little queasy for like a day or two, sometimes 3 days after, okay? And they feel kind of tired. They're not quite their usual selves. And then after about 7 to 10 days or so, they start to feel better. But just when you're starting to feel at your peak again, it's now time to treat you again. And that's the way that it's designed. So, are there side effects? Yes. But people get very, very caught up with side effects. And I always tell people, you know what? Next time that you're about to take a Tylenol, take out that package insert and read it. And what you will see is possible side effects are death, coma, seizure, and so on. So, yes, there are lots of side effects, but generally, most people only get one or two or three of them. They don't get the whole page full. So, we have to look at what we're trying to do, and we're trying to balance the side effects with your life. And we also have to be, I'm not, there are some oncologists that will say, do you know what? We've got to keep you on time, on schedule. You have stage 4 disease. You got to get your chemo every time. Okay. I tend to take a slightly different approach in that I say, do you know what? Let me know if you have that wedding coming up, if you have that graduation coming up, and you want to be in tip-top shape, and you want to take a week off or 2 weeks off, or you have a family trip coming up, and you're like, you know what, doc, I don't want this stuff in me. We've been planning this family cruise for ages. I say, you know what, the reason why we're doing this is so you can live life, not be alive, but live life and enjoy it. Okay. So fear is our biggest issue. And fear is what causes most of the problems in this country. Okay. Approximately 50% of patients in the Bahamas present with advanced disease. Okay. And
And
by that,
why? And you saying that it's attributed to fear most
yeah,
times.
yeah. And we in the Bahamian culture, we generally don't go to doctors. We wear it at it's kind of like a badge of honor. I ain't never been to no doctor in my life. I ain't never been to the hospital before. I'm healthy. I'm strong. And just because you're feeling good or whatever, it does not mean that your cholesterol isn't sky high or that you got diabetes that's rampaging out of control, right?
Or
And
sinusitis, that's the common one. It's my
right,
sinus, yeah.
yeah, it's my sinus, right? And so we have this mindset of we don't need to see our doctor. And primary care physicians, every person in this country should have a primary care doctor, someone that knows them, someone that understands them, and can pick up little subtleties that maybe someone in their family wouldn't recognize. Because the other thing that happens is when you're going through these changes, lots of times your family members don't recognize it because they see you every day. So when you change gradually and slowly over time, and you're seeing that person every day, you don't necessarily notice it. But if you see a doctor once a year, once every 6 months, and you walk in the office and they're like, wait, what's been going on? You look horrible. And then that's when people are like, ooh, doc, what you saying, right? So we really, breast cancer, prostate cancer, colon cancer, cervical cancer, those are the four most common cancers in the Bahamas. Okay, those are the top four. What do all four of those have in common? Every single one of those are cancers that we can screen for. Okay, so breast cancer, you do mammograms. Prostate, you do your PSA. Cervical, you do your pap smear. Colon, you do your scope. But we do not avail ourselves of those tools. And that is a huge problem.
Now, let me ask here though. In a lot of cases, some women are not diagnosed until, yes, they're stage 3, stage 4. And you would hear some of these women say, but I didn't have any symptom. I mean, let's talk a little bit more about that. In some cases, it may not present with symptoms until it's at a later stage. Why do you think that happens?
Well, you have to remember the human body is an amazing thing, right? God did a lot of miracles to create this body that we have. And what happens is, as you go along, your body adapts. So you might, but you don't notice it. So most of the times when I ask patients to think back, I said, 2 years ago, could you run up a flight of steps? And they'd be like, yeah. And I'll be like, I bet you can't do it now. It's like, and they'll sit down, they'll think, and they'll be like, you know what, doc? You're right. Because what we do is we adapt. So we adapt and find ways to continue to do the things that we normally do, but we just do them differently. Okay? It's the same thing. Think of it like a heart attack, right? So with a heart attack, the heart, you have high blood pressure. High blood pressure has been stressing your heart out for years. Over time, that heart gets a little bit bigger, a little bit bigger, but you adapt. Why? What do? You stop running as fast. You may not notice that when you talk, you're taking a deeper breath here and there. And then all of a sudden, the heart gets to the point where it can't take anymore, and bang, they have a heart attack. And that's when you hear people say, no, 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 but Johnny was healthy all them years. Johnny ain't never had nothing wrong with him. What you mean he had a heart attack? And what you mean he dropped dead? No, Johnny wasn't healthy. Johnny wasn't looking after his body and wasn't checking and doing his body's servicing. You know, people treat their cars better than they treat their body. There are people that will make sure that car gets that tune up and oil change on time every time, but they let their bodies go to waste. Okay. And so your body will adapt. And 100% of the time when I talk to people and I ask them to just go back a year ago and think about what they were able to do then and what they're able to do now, they pause and they say, you know what, doc, you're right. But I didn't even think about that. I didn't realize that. And that is why we tell people it's important to get your yearly checkup. Go to your primary care physician, get that yearly checkup so that we can preempt things and address it before it happens.
Now, what about our younger patients, Dr. Curlin? We're seeing, and you all have been seeing a lot more younger women being diagnosed with stage 3, stage 4, 20s, early 30s. Why do you think we're seeing a lot of that? Even so, you think it's genetically related? Is it environmentally related? Why are we seeing a lot more?
Okay, so when we look at breast cancer, so the average age of breast cancer in the US is about 61 to 62. Average age in the Bahamas is about 53 to 54. Okay. Within that, we have in the US, if you look at women with breast cancer, about women less than 40, I think is about like 5% or so. In the Bahamas, that number jumps up to about 18 to 20%.
That's high.
Yes, it's very high. And a part of that reason is genetics definitely play a role in it. Okay. We have thus far the highest incidence of BRCA1, which is called BRCA1 gene mutations that have ever been done. So we have the highest rate. Our rate is anywhere from 23 to 27% of our breast cancer patients. The next highest group after that is the Ashkenazi Jews with about 10 to 12%. And in the general world population, it's probably less than 2%. So we have an extremely high incidence of genetic breast cancer. Even looking at that, though, when we take out our young patients that are BRCA positive, we still have a very high number of young patients that are BRCA negative. So we probably have some other genetic factors that are floating around that we just have not are discovered yet. And it'll be a very good point of research to actually go and do more sophisticated gene studies on these young women and see if we can identify more breast cancer genes here. So that is the main reason. Now, do other reasons contribute? I am sure that our poor lifestyle habits, our rate of obesity, our lack of activity, our sedentary lifestyle, do all these things contribute? I'm sure, because the other thing, when we look at the obesity, right, in our breast cancer patients, so when we break it down into postmenopausal versus premenopausal, you would think that, oh, well, all the obese patients were in the postmenopausal group. But actually, the overweight and obesity number pre and postmenopausal was still about 80-something%. So we have young, obese, unhealthy women, just like we have young, obese, unhealthy men. And I think that's a huge part of it. But we are just now beginning to tell the story of breast cancer here. And we're discovering so many things about our breast cancer patients. And as we do more and more research, I think that we're going to be very surprised at some of the things that we find.
Very interesting, very interesting. Now, question. When you encountered Dulcie, give us some feedback as to your thoughts on her condition and your approach to treatment.
Okay, so as I said, so along came this force of nature into my office, essentially, right? But you look at the individual person, okay, and you look at what their realistic goals are, and so Dulcie's goal was, I want to see my daughter graduate, okay, and just to be clear, I've had patients that say, Doc, I want you to keep me alive until my grandchild is born. And I've had them walk out and say, Doc, grandchild is born. Check you later. I ain't doing this no more. I'm going home to die. And they're happy with that. Okay. And that is.
And that's a reality.
Right.
People, we have to be realistic. That is a reality.
And that's a realistic and sensible choice. But I am always going to try my best to at least get you to set a goal that we work towards. So I looked at her. She's young, she's healthy, she's in great shape. The thing that's beating her up.
That sounds paradoxical, eh? She's young, healthy, and in great shape.
Right.
And she has stage 4 breast cancer.
She's young, she's healthy, she's in great shape, she's lived a healthy lifestyle. The only change that happened in the last year is this cancer. And this cancer is what has wreaked havoc on her body and gotten her to the point as to where she is. Okay. And I sat down with her and I said, you know what? Well, there are quite a number of therapies that we can try. And we're going to push forward. And I definitely think that we can get you to your graduation. And I said, we're going to look beyond that because there's lots of new things that are coming out all the time. Okay. And I also tell everybody in a very frank discussion, I let them know, look, there may come a time when there is nothing else, when there are no other options. And when that time comes, I'm not going to sugarcoat it. I'm not going to try and, make it look good. I'm going to tell you, we've tried everything. It's time for you to go home. It's time for you to be comfortable with your family. There's nothing else that we can do here. And I think that when you're honest with people and you're straight up and you don't give them false hopes, because that is a dangerous thing. So I don't give people false hopes. I give them a reality. And the reality is that we know we're all going to die, okay? We could walk out tomorrow and get hit by a car and be gone. So I also tell people, take this opportunity you know that you've got some added stress on you now, and barring a miracle or some new drug, it looks like you are probably going to die a bit younger than you would have. But take that opportunity then to really look at what's important, and take that opportunity to enjoy and to live life to its fullest. If there comes a point where you say, I don't want to do this anymore, I'm going to sit down with you and I'm going to talk to you and ask you why. I'll let you go through the options. I'll explain some more things to you. And if that's the choice that you make, even though there are times when I will disagree and I may want to push on, but I also have to respect your wishes. And the only thing I can do is tell you, well, there are other options. But if you say no, then my job becomes, okay, we're transitioning to a different phase. We're transitioning to let us make sure that this next couple of weeks or couple months that you're going to be surrounded by the people that you love, that you're going to be doing the things that are important for you. There are other patients who look me in my eye and say, you know what, doc, there has to be something else. No, there's got to be something else. And I have to tell them, no, there's nothing else that we can do. So I think you have honest conversations with people, and even some people get very mad with you. Some people get very upset. Some people want to go for second, third, fourth, fifth, sixth opinions. And as I tell people, you know what, there's only one of you. And I'm not going to get upset if you go for a second opinion. I'm not going to get upset if you go for a third, fourth, and fifth opinion. The only thing that I would ask is that if you're going to do so, let me advise you where to go so that you don't end up with some quack somewhere, okay? Because ultimately we all want what is best for you. I'm going to stand by what I say, and I'm going to always try and do what's best for you.
You know, Dr. Curlin, powerful conversation this evening. It's a realistic conversation because a lot of times we like to talk about the treatment aspect, but we don't like to talk about the reality of when there is nothing else available, what do I do? You know. Now let's get back to Dulcie for the last 10 minutes or so of the session. Dulcie, how are you feeling now? Tell us, when was your last treatment? I think you said it was recently. And how are things going for you?
I had a bone treatment on Thursday. Like I said, I had some joint pains, extreme joint pains. Other than that, I am doing quite well. I had a very active day. I was outside messing around with plants. And so I have a very good day. I'm feeling very good. I'm on vacation, and I hope I stay feeling very good so I can enjoy the rest of it to the fullest, you know. And what Dr. Curlin was saying just now, what you were saying, it just reminded me that every time I come from the doctor and I say, well, this medication obviously ain't working, the first thing my family says is, okay, we don't want to know that. He have something else to give you, because we know the reality is, and my family is so familiar with this routine. And like he said, you have to be realistic. You have to be realistic with your disease. And all they want to know is there something else you could get, or is it? Because we know after that, we already know what the possible outcome could be. And once you're able to accept what they say, the serenity prayer, what they say, accept the things you cannot change. When you're able to do that, you have a happier life and you have a fuller life. You do the things that make you happy. You know, I always thought that I don't have stress. I give other people stress. I got a big mouth. I say what I feel like saying, and that's it. So I thought,
suppose you can get away with it at this phase of your life.
Before this phase of my life, I was like that. It's been a full life. Cancer has taught me so many things. Some people look at cancer as being bad. I don't necessarily, I mean, nobody wants to die, but cancer has taught me a lot of things. My journey has not been, I've heard of so many instances where people have had bad experiences with doctors, bad experiences with this, I say, you know what? Yeah, I don't have a smooth ride with cancer, but you know what? I try to make the best of my situation. I try to do what my doctors say, and anything could happen to anyone at any time. Life is for however long I am here. I tell people, when you see me in the newspaper, know that I fought till the end. That is just what it is. But until such time, I am going to live my life to the fullest. I'm going to do what Dulcie feels like doing when Dulcie feels like doing it. And no complaints. As long as I have my team behind me, I like my team.
Wonderful,
I like,
wonderful.
yeah, I like my team. When everybody else gave up, they're the ones that gave me hope. And you know what's so interesting about that? We like to think that foreign is so much better. And even my foreign team said to me, well, they ain't my team no more, but they said to me, whatever those doctors are doing for you in the Bahamas, they're your doctors. They're keeping you alive. This, because I had to go back. They told me I only had 4 months to live. So I went back after that 4 months was up, and I sat up in front of their faces, and she was like, "You still here?" I said, "Oh yes, I'm still here." She said, "Okay, whatever they're doing in the Bahamas, they're your doctors. You continue to consult with them." And so, I love my Bahamian doctors. I don't have any faults for American doctors, but my team that I am working with has helped me to continue on, and not only to continue on, but to continue on to have a positive attitude, because they're the ones that help too. They don't come in there crying or looking gloomy. They're frank with me. And that is what I appreciate. They tell me this is that, and that is what I appreciate with them. And I think that's a large part of what has helped me to survive thus far.
Dr. Curlin, what about the men in our, are you seeing a lot of males with breast cancer? Let's
No,
talk
I
a bit
mean,
about those.
male breast cancer is very rare. In the past, we may get 1 or 2 cases per year max. So it's not something that we see very often. The treatment for male breast cancer is essentially the same as the treatment for a postmenopausal woman. It's so the same drugs, radiation if needed, hormone therapy if needed. So the treatment is pretty much the same.
Let's talk a little bit about the hormone therapy, tamoxifen and anastrozole, and I'm sure there may be others. Could you just let our audience know the purpose of these drugs during treatment and after?
Right. So when you look at breast cancer, so certain breast cancers have receptors on them that bind the female hormones. So the same hormones that cause you to get your periods, that cause you to develop your breast, those same hormones can stimulate certain breast cancers to grow if they have that receptor. So the progesterone receptor and the estrogen. Okay. So one of the treatments that we give if your tumor is positive for those hormones is we give you medications to block those hormones from being able to bind. And we know that when you take this hormone therapy, that your risk of a breast cancer recurrence is reduced anywhere from 50 to 70%. So it becomes a very important part of therapy. We generally give it after you finish your chemotherapy and radiation. And usually you take it for a period of 5 to 10 years. The side effects are very similar to that of menopause. I mean, you can get some hot flashes. So I always tell husbands, if your wife seems like she's going a little crazy or she's a little emotional at times, blame me, And I also
send them to you.
Yeah. And I also tell the patients, I said, well, this is the one time when you have an excuse. So if you got to go crazy, go. So it's one of the therapies that we've used. And in recent years, there's been a new line of drugs that work in conjunction with the hormone therapy in metastatic or stage 4 disease that has had tremendous results. So once again, this is where things change. So when Dulcie first started out, that drug wasn't available, and then a few years later, it's like, oh, Dulce, guess what just came out? Let's throw you on it, right? So hormone therapy is one of the things that we use. Now, getting back to my point of obesity. So we know that people who suffer from obesity, those drugs may not work as well because fat cells essentially make estrogen. So it may make those drugs less able to do what they're needed to do. So that's another reason to really jump on the obesity situation in this country.
Now, as we begin to wrap up, Dulcie, what advice would you give to the listening audience at this point in time and phase of your life?
We have to enjoy each day. Cancer isn't taking the conversation nowadays. COVID-19 is taking it. And every day that we live, we have to enjoy it. Not only do we have to enjoy it, but we have to respect people. And we also have to respect choices that people make. There's so many things that are happening in this world right now. There are a million ways to die now. Cancer's kind of second seat or third or fourth seat right now. But the only thing that I can say to people is enjoy your family, enjoy your friends, enjoy life. And no matter what battle, because we don't know the battles that people are fighting, no matter what it is, it could be diabetes, it could be high blood pressure, but whatever it is, we have to learn to seek the best advice possible. We have to follow the best advice. You don't listen to everybody in the marketplace. Live life to the fullest and try to use common sense in a world that could seem nonsensical nowadays.
So true. Now, to you, Dr. Curlin. What should we be saying to our Bahamian women?
So I'm gonna,
because you're gonna see many of them again next week. They're gonna show up and they're gonna continue to show up. So what should we be saying to our Bahamian women and women in general?
So it's not our Bahamian women, it's our Bahamian people, period. I think we have to change the mindset. And as a whole, we have to let people know if you feel something wrong, if you know that there's something not feeling quite the way it should, go to your doctor. If the doctor tells you there's nothing wrong and you're still feeling something wrong, you heard Dulcie, she persisted, okay? This is your life and this is your health. And we really have to be more conscious of this. Women, you should get your mammogram starting at the age of 50. But if you have a family, starting at the age of 40. But if you have a family history of cancer, of breast cancer, then we go younger, okay? And the story of, Doc, I felt this thing 3 years ago, but I was scared. That is one of the most tragic stories that we see. When you have a woman in her 30s or 40s with 2 kids at home who had a cancer that was fully curable when she first felt it. But now, because of fear, she waited and waited. And now those kids are going to be minus a mother in a few years. A husband is going to be minus a wife. And it's a matter of changing that mindset, becoming aware of our bodies, doing the screening that we need to do. And this doesn't just apply for breast cancer. Okay, we are an unhealthy nation. We are number 6, I think number 6 in the world in terms of obesity, which explains our high rates of cardiovascular disease, our high incidence of strokes, heart attacks, diabetes, and cancer. Obesity increases your cancer risk. We need to get back to old principles. We need to change the way we eat and the way we live. Um, I think that we really need to put pressure on government institutions to, and I have to say that they have been focusing now more on overall health. They have a backyard farming thing going on now. That becomes important when, you know, our grandparents who were on the island going out on the farm at 5 o'clock in the morning, eating fresh produce as opposed to all this processed stuff that we eat, it makes a difference. We need to focus more on eating our natural Bahamian fruit. I mean, our cherries, our guavas, our hog plum, scarlet plum, pigeon plum, things like that. You know, I was speaking to a group of young doctors the other day, and 80% of them never heard of that stuff. They hadn't had it.
They've missed out so much in life. I'm sorry
Yeah.
to say. They've
And
missed
instead,
out.
we focus on the North American and European fruit. We have an abundant supply of very healthy cherries. Have an extremely high rate of vitamin C, for instance. So I think that we need to focus on that overall lifestyle change. We need to focus on our screening and just changing the Bahamian culture. Solid slash is not sexy. Solid is obese. And we have to come to that realization. But it's hard because my patients, I mean, I have patients that tell me as soon as they're done, they'll tell me, boy, doc, I can't wait to put this weight back on. You see how skinny you got me? And I'm just sitting there like, no, you look beautiful like this. Mm-mm. My husband say, say he ain't for this.
So
And
maybe we need
it's
to
a
work on the
natural thing.
mindset. We need to work on the mindset of the Bahamian man, the male.
We
They
need to
need
work
to
on everybody.
understand.
Because it's the same thing. Wives say, "Hey, doc, my husband getting a little skinny. What you think going on?" Right? It's a whole general concept that we need to work on.
Now, let's talk a bit about screenings also. For some patients, they may have to do more than the mammogram, or is the digital mammogram sufficient? Let's talk a
Okay.
bit about that.
So everybody should start out with a mammogram. Bahamian women tend to have breasts that are more dense. Dense breasts, it can be harder to see things. So we do a mammogram and an ultrasound, but in very young breasts and very dense breasts, the MRI is actually going to be a better tool. So it depends on what the findings are. If there's something suspicious and we can't really tell because the breasts are really dense and something's on the mammogram, go for the MRI. So everyone should get a screening mammogram, as I said before, at 40, unless you have a family history. If you have a strong family history, depending on what
What about
age,
the BRCA? If you have that BRCA in your family,
if you have BRCA, then we generally start with MRIs, and we generally start that in your 20s.
okay, that is so important. I think you need to repeat that.
Yeah. So for those who have a BRCA gene, because those patients are going to be young initially with very dense breasts, MRIs tend to be the best tool. Okay, and we start that usually in the 20s.
Now, are you getting that word out to the general physicians? Because I know in a lot of cases where they don't recommend it, they would just say, well, let's do the ultrasound every 6 months. Is that sufficient?
As I said, it depends. There are some breasts that may not be as dense. Okay, so mammograms and ultrasounds may work for those people. So it all depends on what's there. But in terms of getting the word out, I think that we've been doing a relatively good job. I think that there's always room to improve. At At this point, though, based on some of the research that we've done, for instance, if you have someone in your family with a history of breast cancer, okay, up to 3%, in a study that we did, up to 3% of patients who had a family history of breast cancer, up to 3% of people with no breast cancer actually had that gene that was present. So at this point, we should probably be at the stage where if you have a family history of a BRCA gene, you should be tested. If you have a family history of breast cancer, you should be tested because our prevalence of that gene is so high.
And then it's also high in the women who have the negative, who have
Right. So
negative for
that's a
estrogen.
different, right. Well, the triple negative category is what you're talking about now. So triple negative
Right.
means that you are not, that your breast cancer doesn't have any hormone receptors, and that it's also HER2/neu negative. HER2/neu is a growth factor that occurs on certain breast cancers. Triple negative breast cancers tend to be a lot more aggressive than non-triple negative. Why is this important? Well, what we found is that about 35% of Bahamian women diagnosed with breast cancer are triple negative. When we compare that,
That's high.
right, because when you compare that to the States, it's about, in white women in the States, it's about 10 to 12%. In African American women, it's been reported as high as 26%, but usually they say it is about 20%. So it shows you that all quote unquote Black people are not the same, because even though most of the Bahamian population is a Black population, our breast cancer behaves a lot differently than that of African American women. So 35% triple negative. That's an extremely high number. And that's also one of the reasons why you say, how do these people just pop up with breast cancer at stage 4? Triple negative breast cancers tend to be a lot more aggressive. They spread faster. In addition to that, there's something called grade. Grade is also very important in terms of how rapidly a cancer will spread. Our women have a much higher incidence of grade 3 breast cancer than our counterparts in the US. So many times I will get a patient who comes from away and they say, well, you know, my doctor said this is what I want to do and so on. And I may say, well, I understand that. And I understand based on what's happening in the US, that's probably what I would recommend if I were there. But I let them know Bahamian breast cancer tends to be a little bit more aggressive. So there are times when we do things that are different. And patients, you know, they're like, no, but my doctor says this, my doctor says, and I have to sit them down and explain and say, I understand that. But the Bahamian breast cancer is a different entity.
Totally different category.
Yeah.
Yes, unfortunately, that is something we have in our country. It's probably not going away anytime soon. It's a reality. So the more women and persons are informed about it, you know, the better able they're to make decisions and informative decisions. Dr. Curley, we're so grateful and thankful for you and Dr. Turnquist. You're the two main oncology persons here in the Bahamas. And then also to Dr. Francis and others who work on a continuous basis to help the Bahamian women in our country. We need to be talking about this on a regular basis. As Dr. Francis, when he came on, he said we should not just be talking about this during October for Breast Cancer Month. Breast cancer is something that we need to keep in the forefront of our Bahamian women because they're being diagnosed on a daily basis at a very earlier age. And we need to be more open about it. And that was one of the reasons why I wanted to have Dulcie on, because Dulcie has been very open about living with cancer, you know, and very few women want to talk about living with cancer. Very few women want to acknowledge that they do have cancer. And I think the more open we become about what we're dealing with, the more persons we would be able to help. So kudos to you this evening, Dulcie. We truly appreciate listening to you. You have so many fans on this evening, and then Dr. Curlin, all of his fans are on, I think, you know. They're sending a big shout out to you, Dr. Curlin. They love you. You must be doing something wonderful for these women. But I want to thank you for coming on this evening for our final session to discuss these relevant, pertinent topics that involve women and Bahamian women in particular. Thank you to the audience who have listened patiently. A lot of them have enjoyed the conversation. They've gotten a lot of good information. We appreciate a lot of the statistics that you've given to us, Dr. Curlin. And you need to keep the research going. That is vitally important.
Right. So I'll just want to say, so we're next year expect some big things because we're going to be publishing quite a bit of some of the stats that I just said to you, and we're going to be trying to go with a very public campaign to really alert people as to what's going on. So expect to hear a lot more from the oncology community here. And we are looking forward to 2021. Things got a little sidetracked because of the whole COVID stuff, but we've still been working hard and diligently to try to get this stuff and put it together. So we'll be getting it out there in full published form very shortly.
Well, just let us know, because we will have to have you come back on again in another quarter and talk about these things, because breast cancer is prevalent, and we need a lot of our women to have options and informative options, and to know that there is help and hope. And of course, yes, PET scan is being done in the Bahamas now also, and most of the treatment are available in the Bahamas. So women need to know that. And of course, it's important to have insurance. If you have that, you need to have assurance, for one, because God is the one who's ultimately in control.
So just to comment on that, just to interrupt you briefly. So I think that it's important to know that when it comes to cancer care, and this is not just for breast cancer, this is for all cancers. Right now, every subspecialty, with rare exception, is available here. The oncology team, the surgical oncologist, the cardiothoracic surgeons, the gastroenterologist, radiation oncology, everything that is needed is here. And I think we're very blessed and lucky in the Caribbean to be probably one of the few countries that can boast that. Just about, unless there is a research protocol that's going on, any drug that you can get in Europe or any drug that you can get in the States, you can get here. And I think that becomes important for people to know and to understand. So the full team is here, and we work together. We're in constant contact with each other. We're WhatsApping each other all day. So I think that the Bahamian public needs to take some confidence in that, in knowing that we've been working very hard to develop this team of people, and things have been going really well.
We've come a long way since 20 years, believe me. I've seen cancer for so many years in and out of my family, and different treatment options available. So I'm grateful that 20 years later, so much has happened for us as a country in terms of cancer treatment development. And we will continue to develop as time goes on. So I want to say again, thank you to you and your team for the awesome job that you guys are doing. And keep on keeping on. To Dulcie, thank you so much for coming on this evening to share your story. And to the rest of our listening audience, I want to say thank you for supporting Share Your Story for the past 6 weeks. We only were going to do it for 1 month, but we ended up going over into 2 weeks because, yes, we had to discuss some other very important issues. The show has been brought to you by Palmdale Vision Center. Thank you, Dr. Curlin. Thank you, Dulcie. And to the rest of the team, I want to say good evening. And I'm sure Dulcie and Dr. Curlin would like to say good evening also. So I'll give them that opportunity. And we will end, but Dr. Curlin and Dulcie, don't leave the studio as yet, please. Any final words? Dr. Curlin, any final words to your
I
audience?
would just like to reiterate that do your screening. If you are a family and you don't have a primary care physician, we have a robust family practice group here locally. Our family practice numbers have improved tremendously. So every family should have a family practitioner. We like to say that we are a Christian nation. Well, I always remind men that a part of being a good Christian father is taking care of your family's health and putting your family's health first. So that is the major take home. Make sure that your family is eating right. Make sure that take your family for a walk, go and exercise, go stretch. Okay. We have a lot of work to do, but the good news is that we can do it. There's still a lot of time for change.
Thank you so much, and good evening to everyone. And I have to say thank you to my husband and son again. Appreciate all the help and support that you've given to me for the past 6 weeks. So thank you, Bahamas, and thank you to the world, and good evening. Guys,